everybody. I decided to make a little video to help people out with a particular subject area of what's going on with all the chaos with coronavirus, and that is your news and information diet. Some of you may know that before I was a Kundalini yoga teacher, I was a reporter and an editor in daily journalism. I actually used to cover crime, which comes as quite a surprise to some. And for those who knew me when I covered crime, the fact that I'm a yoga teacher comes as an equal surprise. But I wanted to give you some tips for how to responsibly and, shall we say, safely take in news and information right now, because I'm hearing from students and friends a wide swath of different reactions. Everything from really panic-driven, obsessive 24-hour news channel watching to a complete rejection of any basic news information, like just unplugging completely. And I'm here to tell you that neither of those two things is wise. You do need accurate information. We're in a national health crisis, the likes of which we've never seen in our lifetimes, and just by virtue of the size of our population, we've never seen before. But neither is it a good idea to be saturated with information that you've already heard and that is just going to frighten you. It's just kind of going into your system again and again and again and overstimulating you. So I want to talk about three basic things. I made some notes. So three basic things that I would like for you to think about as you are trying to get information about what's going on around you right now. The first is limit your intake. What I mean by that is there is absolutely zero reason that you need to have a news channel on nonstop. You will not get any new information in that time frame. It's not going to happen. They're not bombs falling from the sky. We're not in that kind of a situation where you need to have your radio on all the time, right, to the news. This is a situation that you can elect to turn on your TV at a designated time, get a specific amount of information, turn it off. Better yet, my favorite, radio or even print. I know it's not nearly as exciting as just clicking the channels, but it's a really good way to get your information. So limiting your intake, deciding, for example, maybe you want to catch the 9 a.m. news. That's fine. Get your update and then get on with your day. Or maybe you like to get your news more around the evening hours. Fine. If you want to check in more than once, that's okay. But again, limit the time frame you're doing it. So that's number one. Limit your intake. Number two, and in many ways for me, this is number one. Consider your sources. I cannot emphasize this enough. Consider your sources. Where you get your information is as important as anything else you could possibly consider when you are trying to find out what's going on. Okay, so right now, I recommend going to local news sources for the most relevant and accurate information. For example, this is a very localized issue. So if you're in Florida, that means you're under one set of rules and one set of circumstances as if you're in California. If you're in Los Angeles, where I live right now, you are in a different set of rules as, say, someone in Riverside County. So, and that is largely based on the number of cases. Yes, in some situations, it's the political factors. That's true. But the public health officials in your area are the people that you want to be listening to, the public health officials. They don't have a dog in this fight other than public health. They just don't. They're usually kind of wonky. They're usually kind of statistics and research driven, right? And they want to tell you things like number of known cases, what kind of testing they're doing, what the latest procedures are for keeping safe. It's not exciting, but it's going to tell you so much more than just sitting on CNN and listening to a bunch of talking heads go on and on about masks and whatnot. I mean, those are important topics, but find the information from your local news, the local sources. Which, that being said, if you can even bypass the local news and just go straight to the local briefings in your area, I highly recommend that. Here in California, we're very fortunate. We have excellent daily briefings from the governor. In Los Angeles, our mayor's office has done a great job. And Los Angeles County does a briefing as well. And it's the Los Angeles County Public Health Division that's kind of in charge of a lot of what's going on as far as testing and cases and reporting. So that's really key, is try to go right to the source. You can go to the government, your state or city government website. I do not recommend going to federal level sources at this time because that effort is not clear. But your state and local officials are going to have more legitimate, relevant information on everything from the medical situation itself to unemployment and those issues, small business loans, rent, if what's going on there, services that you might need, especially if you're in a situation where you have some, family needs, or you need some help with like food bank, things like that. Okay, so that's one, is limit your intake. Two is consider your source, go local, go specific. All right, the third one, this could be number one, but then I just said that about number two. But this could really be number one because this goes for any situation ever. Listen critically to the information you're hearing, okay? Listen critically for the difference between fact versus opinion or slant, or even, I don't even mean that in a sinister way, just take subjectivity. I'll give you an example. Learn the difference between fact and what we call editorializing, okay? All right, here's an example. You might hear on the news that someone in, say, the Democratic Party or a governor of a state says, the president didn't act early enough, okay? And then you might hear from the White House press briefing room, the president or one of his people say, we've been on top of this since the very beginning. Both of those statements are subjective. They are opinions. What does early mean? What is early? Early is an opinion, okay? And we've been on top of this since the beginning. That's an opinion as well, okay? Here's a fact. Here's the difference. Here's a fact. The WHO, the World Health Organization, the CDC, medical experts, both research, clinical and in the field, everyone, are very clear that the only known action that can be taken to slow the spread of this virus right now, because we lack adequate testing, the only known thing that will actually slow the spread is what's called social distancing, physical distancing. That is the only thing that medical experts agree is known to prevent any part of this. No, it's not a cure. No, it's not 100%, but it's the only thing that will slow, proven. It's the only thing that has been proven to slow the spread, okay? It is also a fact that as of today, the beginning of April, there is no national stay-at-home order. Those are two facts. Whether or not what that means to you, if that means that things haven't been handled early enough or not, that's an opinion you're entitled to have, right? Anyone's entitled to have. But learn to listen carefully to the information that is being shared, because people have their opinions and they're entitled to them, and they're entitled to say them in any context they want. It is your job to think about what you're hearing and not just pass it along or freak out about it or swallow it whole or reject it. Just listen. What are the facts versus what you're being told, right? Oftentimes they're not the same thing. And I can promise you this, if you stick to the facts, if you focus on facts, which PS would have a lot to do with science, and we have, unfortunately, we have an epidemic of disbelief in science anymore in our country, which is very sad. But if you stick to facts, then you will probably have good, accurate information, okay? So limit your intake, consider your sources, listen critically to discern fact from opinion or subjectivity. All right, I hope this was helpful. I know it was a lot, but if you're still with me, thank you for listening, and please, please, please share this with others.